Hi, this is Jim.
And Ralph.
And we welcome you to Psychology Takeaway, the podcast where we look at new things in psychology or old things that might be relevant today and try to make them relevant to you.
And to us.
Well, Jim, how are you today?
I am fine today, Ralph. And you? I think
I'm good.
I'm a lot better than I was last week. The snarfles are going away.
Excellent.
I think that's a sign of fall and winter coming on.
Not so excellent.
Well, last week's guest has joined us again, Ms. Bridget Eagleson, who just happens to be my daughter. Hi, Bridget.
Hello.
Just happens to be an expert in autism.
So we're going to go and take a look at part 2 of our adventures in autism, and that has to do with how we diagnose this particular beast. Okay?
Okay.
Now,
So,
last week you had 3 diagnostic categories, Ralph. Good, bad, and dumb.
Normal.
Yeah. Okay, so...
and I hasten to add, in thinking of that diagnosis, which was prevalent in the 1950s, the normal kids were mostly girls because they were quiet. They did what the teacher wanted them to do at the time they should be doing it. And the bad kids...
Don Murtis, Billy Kelly, Bob Doherty, you, me, they were bad.
They were bad, and
I think,
they didn't do what the teacher wanted in the time the teacher wanted them to do
yeah,
it.
well, we weren't considered emotionally disturbed. I don't think we were considered criminals, right?
Kind of, yes, criminals in being, if not in full flourishing. And so normal kids, bad kids, and
Dumb kids.
dumb kids. And dumb kids, probably some of them were below average in IQ, and some of them might have been diagnosed with autism today.
It could be.
Could be.
Or
So, you know,
some were just unmotivated.
yeah.
So. Okay, well, let's take a look at how you diagnose somebody. Bridget, in general, as a social worker, you do some diagnosis, right?
I do some, yes. The real problem comes in with insurance. At the master's level, most insurance companies will not cover a lot of therapies for autism if the diagnosis was given by a master's level practitioner.
So you need somebody with a doctorate and a license in psychology like me?
Yes, or an MD or a psychiatrist.
Okay. So, hey, got a question for you. How easy is it to find a PhD level psychologist, psychiatrist, or MD to make the diagnosis?
Very, very difficult,
That's what I thought.
particularly if you're not a early childhood, early elementary white boy.
Say some more about that.
So a lot of the traditional ideas about autism were based around this image of a young white male who's obsessed with train schedules, right?
Okay.
That's kind of what we see in the media. And certainly that is a presentation of autism. I have met some individuals in my lifetime who certainly meet that criteria, but that is not capturing this whole other portion.
The spectrum. Okay.
Yes.
So, do you find that most mental health practitioners at the doctoral level are trained in diagnosing autism?
Absolutely not. Even people who got their degrees as recently as maybe 20 years ago, or even possibly 10 years ago, will freely admit that autism was not talked about much in their classes, especially not their diagnostic classes. And it was typically only mentioned maybe in a child development class. And really the characteristics that were discussed would be what is now considered like level 3 autism or possibly level 2.
Really severe.
But really nobody has any training most of the time in how to recognize individuals who would fall in that level 1 category, like myself.
Yeah.
So, Jim, let me put you on the spot. Suppose Bridget called you up and said, I have a client here who really needs insurance support through their insurance company, and we need a diagnosis. Would you do one?
Okay.
Would you feel comfortable with somebody who came into you and said, Bridget sent me?
Okay. The quick answer would be no. Remember, most of my experience has been with personality disorders, starting back at the penitentiary level and then going into elementary schools. And so I have not seen very many people who would, I think, fit the category of the diagnostic criteria of autism. And so I would have to, I think, just bow out from that, participating in that kind of a diagnosis. It'd be malpractice, I think, on my part. Having said that, the question then is, can a psychologist who doesn't have the training in the area contribute to a diagnosis? And that is probably yes. If a person has behaviors that are interfering with their social functioning, most psychologists can identify those. If there are some areas where a person has difficulty in transitioning from one task to another, psychologists might be able to identify those. So what we might be able to do is come up with essentially a checklist of things that are part of the diagnostic criteria. But for me to say, the diagnosis is, the ICD 1.673, they're probably not going to fly. What do you think about that, Bridget?
Yeah, absolutely. It is crucial to have specific training in how to diagnose autism, if that's something that you're going to be doing for clients.
Yeah, no. Quite often, a client is going to be seen, maybe first of all, in the school district, and then that person will be referred maybe to a mental health clinic. Now, you've worked in community mental health. How is community mental health doing in terms of, working with autistic people?
So actually, I was employed for a while as the autism assessor for a community mental health as well. And that was one of those kind of loophole things that I was talking about. Typically, master's level clinicians cannot diagnose autism in certain settings with certain insurance companies. We can, as long as we have the specific training, which I did. I was trained in something called the ADOS.
Say that again?
The ADOS. It's ADOS, ADOS 2. We're on the second edition of it.
Okay.
And that is kind of currently considered the gold standard in how to diagnose autism.
Okay, ADOS. So A for autism, D for disorder,
It's the
S for spectrum?
Autism Diagnostic Observation Schedule.
Okay, 2. All right.
Yes.
So you're going to diagnose based upon what you're seeing, right?
Yes.
What the clinician is seeing, and probably what the parent is seeing, and maybe what the school is seeing. Probably get
Yes, absolutely.
multiple data points.
There's
Okay.
also kind of a really interesting thing with autism where a school diagnosis of autism and a medical diagnosis of autism are not the same thing and do not get you access to the same things. So we can see a lot of cases where maybe a pediatrician or a psychologist or someone outside has diagnosed a child medically with autism.
Mm-hmm.
The school will not recognize that diagnosis typically, and the school has their own autism diagnostic process and team who will give the child an educational diagnosis of
Right.
autism if they need an IEP at school.
Okay, right. So, yeah, you could, I suppose, be diagnosed as autistic and not have problems in school, right?
Correct.
Okay, yeah, I can see why the school would do that. But okay, with the behavior rating scale that you're talking about, what kinds of things would professionals and parents be asked to note?
Yes. So, along with the diagnostic process, a really important piece, in addition to that standardized ADOS that I was talking about
Uh-huh.
before, is also some kind of parent interview, typically, where we get really into like early developmental history.
Mm-hmm.
So, we can definitely assess even adults now for autism, but we need to get that information about their first 3 years of life
Mm-hmm.
so we can see where some of those traits would have been present.
Okay. And how would you get that information?
Usually, parents are the best source of that information, but whoever was the primary caregiver for the child during their first 3 years of life is the best source to get. If we really can't access that source for whatever reason, then we may try to go with maybe if the child's had a teacher for multiple years in a row, or really we're going to look for anyone we can find that has the best information about this individual's development.
So, Bridget, let me ask you, is there like a standard questionnaire that you would ask parents? Did this happen? Does that happen? Etc.
Yes, so there is something called the ADIR. Um, and I cannot exactly remember what that stands for. The I, I'm pretty sure, is interview, but it is basically it is a huge booklet of questions. It takes about 3 hours sometimes, anywhere from 1 to 3 hours to go through with parents, depending on what information we need, how obvious the autistic traits are, and all of those things in there.
Okay. Alex has just, you know, worked his magic. Okay, so the AIDR is what? A standardized. Who can read that on the screen?
Autism Diagnostic Interview Revised.
Okay.
ADIR.
So that's what I was using when I was diagnosing autism for the community mental health.
Okay.
And I did find it to be a very helpful, structured interview process. It really does cover everything that you would need to ask of those caregivers in order to have that early developmental
Yeah.
information related to autism.
Yeah. It takes about 2 to 3 hours to complete, but it has to be administered by let's really emphasize this, a trained clinician.
Yes,
And
because of kind of what I was talking about before too, where we have this classic presentation of autism. So there's things like, the hand flapping is kind of a universal sign of autism, and that is one of those repetitive behaviors.
yeah.
But there are a lot of different things that children or even adults with autism may do that still falls under that repetitive body behaviors.
Mm-hmm.
But if you don't know what to ask for more specifically, so if you're just asking, oh, has your child ever hand flapped? And the parents are like, no, my child doesn't do that. Okay, but what are we missing there? Because maybe what the child does is every time they play with their cars, they pick up their cars, they don't actually drive the cars around or create any kind of story with them. They flip them upside down and they spend the whole time playing
With the wheels.
spinning the wheels.
Mhm.
That is also a repetitive body behavior that would fall under that same category and meet criteria for diagnosis.
Okay. When I was working in New Jersey in a public school, I had a kid who would find little pieces of lint and take the pieces of lint and go like this, and they'd look at those little pieces of lint for hours and keep rolling the pieces of lint around and around and around. Aha,
Yes, so the
there's-
modern name for that behavior is actually called peering,
Hearing? Okay.
and it is part of the diagnostic criteria for autism as well.
Well, back in the day, Canner would say that was repetitive behavior, and I'll finish the story in a minute. So I said to the kid, "Why are you doing that?" He said, "Well, because I can." And I said, "What's it getting for you? What's the payoff?" The kid says, "It's just interesting. So is there anything can you stop doing it?" Yeah. Well, okay. So there's a kid who was giving me some signs of autism, peering, but could control it. wasn't autistic.
Sounds like he needs a microscope.
Yeah.
Just give him a microscope.
Mm-hmm.
And
Yeah.
Bridget, like one of the things that, as a layperson, behaviorally, I know that a lot of autistic kids in early years do rocking.
Yes.
They rock back and forth. So is that a repetitive behavior?
It certainly can be. That particular repetitive behavior is very tricky. And actually just rocking like in a seated position does not count as a repetitive behavior for autism diagnosis because of the fact, not that it's not necessarily associated with autism, but it doesn't differentiate well between people with intellectual disabilities often also display that type of rocking. And we don't want to necessarily misdiagnose those folks with autism when they actually maybe are having an intellectual issue that they need some support with.
Okay. And, I've seen these chairs that kids are using today. They're kind of on the floor, like high backs on them. They play their games with them, and they go back and forth. And they're not autistic, and they're not intellectually impaired.
So that's where
They're
that like really good expertise and understanding of autism comes in, right? So that you can differentiate what's just a kid who's really absorbed in their video game and maybe they're moving around in their chair versus specifically what does those repetitive body behaviors associated with autism look like. And that really takes a trained eye in some circumstances.
Yeah. And I think one instance is not going to be enough to make a diagnosis, right? You have to see a body of knowledge.
Yes, that brings up a good point as well. There's this kind of a thought that goes around, right? Everyone's a little autistic. I don't know if we've heard that a bit, but and that is, I guess I think that probably comes from the fact that many of the behaviors associated with autism are human behaviors, right? So many humans do those kinds of things. But in autism, let's just go with the rocking since we were talking about that. We may see a child or an adult who rocks for hours and hours and hours every single day.
Terribly exaggerated.
Right.
Yeah.
Whereas the average human may only rock for a few minutes here and there.
Yeah.
So frequency is also a very important diagnostic criteria there.
Okay. Now, I mentioned that I didn't have much training in autism, and probably the training I had would not meet, modern standards. Have you ever run across a guy named Bruno Bittelheim?
I have not, actually.
Okay, he was an interesting guy. He wrote a book called The Empty Fortress, and he talked about autism. But at the same time, Kanner was looking at it. But, when he looked at autism, he saw very extreme cases, and he attributed autism to the refrigerator mother, the cold mother.
Yes, so I am familiar with that.
That one. And
which is kind of the olden times iteration of blaming mothers for their children with autism that we're now seeing with we're going to blame the mothers for taking Tylenol during their pregnancies.
I was going to get around to that one, yeah. And Bittelheim had a patient in his book called Joey the Mechanical Boy. You probably haven't heard that either. But we have a bunch of pictures in the book, and I'm going to see if I can get a copy of the book and put it up. But Joey was a kid who thought of himself as a robot. He couldn't get out of his bed unless he had... Are we finding Joey the Mechanical Boy here? You're finding Bruno Bittelheim, yeah. Anyhow, he had to have an elaborate life support system that he would construct in order to get out of the bed. And, it was written up in Scientific American. It was fascinating. I don't know anything more about it than that. So our genius here, Alex, is, there are some of there's the article right there. And some of the drawings that this kid made. There's a picture of him with a Patch Adams red nose on his face. Okay. So, Alex, how do you find this stuff so quickly?
It's called Google.
Okay.
Bittelheim tripped me out. I put BI for a while, and then I was like, oh, it's probably BE.
Yeah, Bittelheim. Okay, so our viewers and listeners can Google Bittelheim and find a bunch of stuff about him and about Joey the Mechanical Boy, right?
Yeah.
Okay. So we get off track here a lot, Bridget.
That's all right.
Bridget, I want to go back to something that you said when we were first talking about diagnosis, and you said something about young white boys.
Yes.
Okay, so why them?
Well, actually, you almost touched on this point yourself when you were talking about your diagnostic categories of the dumb kids, bad kids, good
Yeah.
kids, or whatever. And you mentioned something about most of the good kids were girls.
Okay.
And that is also why we're not seeing a lot of diagnosis of young girls with autism. In our society, girls are very pressured to fit in, be very polite, be much more pro-social, and therefore learn to mask at much younger ages. And they may even kind of push their special interests and things that are kind of the hallmark of autism, right? We see young boys, they're obsessed with train schedules or things like that. That are maybe kind of obviously odd, right? Or they might carry a piece of string around with them everywhere. Girls, in an attempt to fit in more socially, often have special interests that are much more socially appropriate. So one of those might be reading, which is a great activity to do. But if we see some young children who are reading all the way through recess and all the time in exclusion of actually interacting with other children, that should be as much of a red flag that we might be looking at a unusual interest in its intensity, even though reading in and of itself is not considered a bizarre interest.
Yeah.
Okay.
Also, Hispanic kids or Hispanic people underutilize mental health services. Blacks underutilize mental health services. Whites don't. They utilize or maybe overutilize mental health services. So if you're not there to be looked at, unless you're in the school, we're going to miss it.
And
Yeah.
if you're in jail for your autism-associated behaviors,
Then,
you're not going to get an autism diagnosis. And we know that individuals who are non-white are much more likely to end up in jail than individuals with white skin.
mm-hmm.
So are we saying that individuals, black or Hispanic, might have benefited from a diagnosis of autism, didn't get it, ended up behaving
Badly.
according to what their peers did, and went to jail?
Correct.
Did something bad and went to jail?
Correct.
Could happen. Yeah.
Okay. So I guess one of the questions is, how do we encourage young people who are not Caucasian to avail themselves of mental health services? And the answer to that for me is damned if I know.
I think that's a very, very big question that is going to take a lot of years.
Yeah.
There's non-white individuals have been extremely harmed by many, many of the systems, the mental health system, the child welfare system, the criminal justice system in this country. And so it makes sense that they might not necessarily be the most trusting of mental health services either.
Correct.
So I think there's a lot that needs to be done in the field of really removing some of those biases and training ourselves in cultural competency in order to gain the trust of those communities. That needs to be step one in order to be able to get more accurate diagnoses and help where it's needed.
Yeah, and the
Yeah.
slaughtering of healthcare budgets, particularly mental health care budgets around the country, is not helping us at all.
No, I don't think that's the direction we should be going.
Yeah.
Not in the slightest.
Yeah, you've heard it first here, folks. Psychology takeaway: the revelation that it's a bad thing to be cutting mental health budgets wholesale. Yeah, I don't think Alex is
definitely,
agreeing with us here.
we should not be creating new holding pens for people who are diagnosed with whatever mental illness. We'll throw them all into the state home and training school that we had here in Mount Pleasant 30, 50 years ago.
Yeah, right.
Yeah, the last of the institutions were closed down in the 90s, so we didn't make it very far before it seems we're headed back that direction, which is a pretty concerning trend.
Mm-hmm. Well, what's our timeline here, Alex?
25 minutes again.
Yeah, 25 minutes. Well, we've opened up a number of cans of worms here that maybe we can come back to at some point in time in the future. Maybe we'll let these 2 episodes kind of percolate down and see if any of our listeners and viewers have questions. One of the things that we note here is, I think down at the bottom it says you can still get a sample of, or read a sample of Curious Kids, and we encourage you to buy a copy of it too. And our shameless promotion here, right, Ralph?
Right.
Okay, so
For all you're worth.
okay, so until next week, let's punch button B. This is Jim,
And Ralph.
and our guest is Bridget Eagleson, and we're saying, keep your stick on the ice
Because we're all in this
together.
Together.